Yes, I am back. I'm sorry it's been so long. I know I say that generally in all my videos, but this year's been extremely stressful. I was in my final year of nursing in the UK, so I am officially qualified. That is crazy to say. It's been a long, long, long time. Um, but I'm officially qualified. Um, I will do some more videos about my final year, and I have a video planned about. I got asked how I work my balance between uni, doing the essays, placement, and having some form of a social life, because as I'm sure you all know or you've heard, it is hard to have a general social life. We have a different university experience than most. Most people have about 9 hours of lectures a week, and that's it. The rest is personal study time. But as we all know, there's not much studying that goes on. Whereas nursing, it's very different. We're on placement plus university, then trying to have a social life, but then also having the essays and studying to do. So I will do a video on that. But today the video is about questions and answers. I've been asked quite a few questions about nursing, and specifically children's nursing, because that's what I do. I can't really answer many adult specific because I don't do it. I've only ever done one adult placement, but it was only 4 weeks, so I wouldn't say I'm a pro on adult nursing at all. I only know children's because that's what I do and that's my speciality. So I will tell you the questions that I've been asked and I will answer them to my best ability. I hope it helps. If it doesn't, or if there's way more questions that you want to ask me, please send them in a message and I will try to answer them. If there's quite a few more, I'll do another video, or if it's only just one small question, I will answer you in the message. So, first question. How much time, if any, do you spend playing with, talking to the children on the ward? Basically, that's all you do. That's all you do all shift long. I mean, it obviously depends what ward you're on. So if you're on neonatal, generally not much. I mean, okay, there is talking, but not kind of having a conversation, obviously, because they're neonates. So generally they're not, sometimes up to 1 month old, and that's it. So there's a lot of playing, depending on their situation. If they're in the intensive care bit, obviously they're not in a fit state, so they're generally sedated in that situation to allow the body to work to recover. So there's not much playing or generally talking. I mean, I talk to all my patients because I don't like doing something without talking to them, even if they're sedated, so technically they're not awake. I still talk to them. I find it weird not being able to. So, if I'm changing their nappy, I'll say, "Oh, I'm just going to change your nappy," and blah, 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 and I have a little conversation with them, just because it makes it feel more normal, I guess. But if you're on a general ward, you're playing, you're talking all the time. Generally, play is the biggest point, because children get very frightened and get very scared about a procedure. You generally have to make a game out of it all the time, or you have a specific way of saying something. So, for instance, if I'm giving medicine by the mouth and the child obviously knows what it is, they've had it before, they don't like the taste, so they don't want to take it, you make a game out of it, call it magic medicine, magic potion, whatever works for that child. Or for another instance, if you're taking their blood pressure, that it can quite hurt some of them because they don't like the sensation of it. As adults, we can understand what it's for and why we're doing it, but a 3-year-old may not understand that. It just hurts and it's weird and I don't like it, you're frightening me. So, if it's a boy, I say something like, "Oh, should we see how big your muscles are?" Or, "Oh, can you flex those muscles for me? Do you feel it?" And whatever. Or if it's a girl, I say, "Oh, can you feel the balloon?" Just little things that you could say that might help them. Some children, nothing helps them, and that's okay too. You've just got to try and soothe them afterwards. But yeah, generally playing is the majority of your shift. You're playing generally all the time. Question 2. Do you do things like change nappies, feed babies, etc., or is that what the parents or healthcare assistants do? Yes, we do it. You should never assume it's not your job. As what I believe is, I'm a nurse. I am there to help that child in whatever way I can. I will never say something is not my job. If the parents are there, generally they feed the child anyway. They might just, when you ask them, do you want anything to eat? Depending on the age, obviously, if they're a baby and breastfed, the mum will feed them. Or if they just want a bit of toast, the mum might just sit there and feed them for you. But some wards, the parents aren't there the whole time. So it depends again. And also it depends how busy your workload is, because I have sometimes been so busy doing like medications and, all the forms the nurses have to fill out and all that stuff, because you have, sometimes I've had 6 patients to deal with, so that's quite busy. So when you're trying to get all the breakfasts done for 6 children, it can get quite time consuming and you might fall behind on the more important stuff, should I say. So that is when the healthcare assistants are lifesavers, because obviously ask very nicely, because it's your job as well to do that stuff. It's not just the healthcare assistants, but just ask them, I'm really sorry, I'm really busy, caught up doing this, can you just quickly get my patient a bit of toast and some water? But never assume it's not your job, because it is. You're there to look after them in the whole entirety. So yes, we do change nappies. Don't want to know how many nappies I've changed. You obviously change their clothes in the morning, give them a wash, change their bedding daily, all that stuff, wash their hair, cut their nails, everything. However, what I will say as well is, if the parents are very actively involved, wait and ask them if they would like to do it. At the end of the day, it is their child, and you don't want them to feel like you're taking over the parent role for them. So, for instance, there's a baby, 6 months old, blah, 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 very happy, awake at 7 in the morning. You've just started your shift. The parents aren't coming in till 10. What do? Well, if they have a dirty nappy, obviously change it. You don't want them sitting in that for 3 hours. If their nappy has leaked, or if they've been sick, or, if they're generally dirty, give them a quick wash and change of clothes and change of bedding if needed. Apart from that, wait until the parents come and say, I've given her a quick wash, I haven't given her a full bath. Would you like to do that? Or I'm happy to do that for you if you so wish. Because you don't want to step on the parents' toes. That is their child, and that's the only thing they can do. And so if the child is very ill, they want to help in any way possible. So if that's changing a nappy here or giving them a bath, let them do it. They're going to do it at home anyway. That's also a new thing as well. If it's a first-time mum and the baby's only ever been in hospital, she's never had the baby at home, try and get her involved. Be there with her and do it with her if she's frightened, because a lot of mums do get scared because they've never done it. They're fragile because they've got cannulas and drips and probes and monitors all attached to them, so it can be scary. They get scared, and I've seen it loads of times where the mum will be like, you go, oh, do you want to have a little cuddle? And they'll be like, no, I'm okay, they're sleeping, just let them be. And sometimes you've got to give them a little bit of a nudge, because when that baby leaves, they are on their own. And when a baby's been in hospital the whole time, that's even scarier than just being a new mum and taking the baby home. So always try and actively get them involved. So, say, oh, shall we give the baby a bath together, and let them do a bit at a time. And so yes, we do absolutely everything that you would do if you were a mother, but get the parents involved first and ask them first. Next question. How are hospital wards set out? Are they set up by illness or by age? Well, I'm only talking from the hospitals I've worked in. Generally, you have separate bays. So a bay could have 4 beds in it. So you generally put patients in, and it depends how the ward manager works and how many beds you have available, because sometimes you can't be picky. So sometimes, yes, you do try and put same age together, because if you have a 13-year-old, they do not want a screaming 2-year-old next to them. That's not cool. And it's nicer to have similar age groups, especially at that age, because they can talk. It's not as boring. They have someone similar age to talk to, share interests, you know, watch TV with, stuff like that. By illness, yes, there are certain illnesses, or like, you know, if they have CPC or, you know, things like MRSA and stuff, you would put them in their own cubicles. So every ward has separate cubicles, and then some have the bays as well. Places like ICU, they're generally an open ward, so you can see everything, and then they have like 6 bays for the really ill children that have like a depressed immune system, so they can't be around anything else, so they need strict barrier nursing, so they will be in the cubicles. But ICU is like one big whole ward, obviously, because if there's a situation, everyone can see what's happening. But most wards, like, yeah, they just have bays and cubicles for children that need to be isolated, basically. Are parents meant to stay with their child 24/7 while they're in hospital, even long-term patients? No, they're not necessarily meant to stay there. On the main wards, each bed for a patient has a pull-down bed for a parent. You only ever allow one parent to stay overnight. You're not allowed to. It's an option. The parents aren't meant to, and they're not kicked out. So yeah, it's really up to the parent, really, what they want to do. However, on places like neonates and ICU, no parent is allowed to sleep over, purely because it's a hazard. If there is an emergency, which happens a lot on ICU, that having a parent lying there takes up a lot of room, and that room is very much needed for the emergencies, so they're not allowed to. However, there is ICU and neonates have their own bedrooms within the hospital that the parents can sleep in, so they are there on call. If something happens to their child, the nurses will ring the parents and inform them, and then they can come down. Or if it's a long-term patient and the parent doesn't want to sleep next to the bed all the time because it's not the most comfortable bed, and if they're long-term, I wouldn't want to, with all the beeping noises. The wards aren't dark, so it's not great sleep environment. Most hospitals do have like the McDonald house where all parents can sleep, and you have to apply for it. So there is a criteria, but generally I've known most parents get it. If they don't live near to the hospital, they do get it. So yeah, it's up to the parents really whether they want to or not. Sometimes, you know, it's better for them to, or sometimes it's not, because the child becomes too dependent on their parent being there, and it can make it worse. But obviously, parents' choice, totally up to them, totally up to the child if they have an opinion. So yeah, really, I think I've answered that. Also another one. I know the emotional side of nursing will be difficult to deal with. Have you experienced a patient dying yet? How did you cope? Yes, I have I've seen 2 patients pass away. How did I cope? It's a tough one. I think I cope very well in a situation, so I won't show how distressed I am at that point, because at the end of the day, you're there to try and help. And generally the parents are there, so if you're looking worried and a bit shocked and a bit terrified, that's not going to help them at all. You need to be that support system for them. So I'll kind of run through a little bit of the scenario. We had a 2-month-old. She had been transferred from another hospital, and as they were lifting her from the transfer bed onto the ward bed. This was on ICU. She suddenly had a cardiac arrest. So immediately it was, CPR. And yeah, I was terrified. It's the first time I've ever seen CPR. And it was terrifying. Obviously, I've done loads of practice ones, on the dummies and stuff. And you know how serious it is and how important it is and how terrifying it will be. But seeing it in life is a completely different situation. If you're doing it if you see it as a student nurse, what I recommend is taking a step back and kind of just taking it all in. Don't try and rush around to help. People know you're a student. You're not expected to jump in, especially if it's your first one, because you're dealing with those emotions and they know that. And you generally cannot help with a lot anyway, because there's a lot of medication flying about and you can't do that because you're not trained, because they're IVs, so we can't do that. I mean, I'm talking English system. I don't know about in America and other places. So yeah, but a good, useful thing to do, which my mentor told me, because beginning of my ICU placement, I asked her, what can I do in that situation? Because I know I'm going to be freaking out a little bit. What could I do that would be helpful? Because obviously, we're doing nursing. We want to help. So she said, you know what the best thing to do is? Get a plain piece of paper out and write down the times everything is happening. So start with the start time of when the cardiac arrest happened, and then from then on you write down the medication. So literally every time people shout it out, because they need to know the doctor needs to know what's been given and when it's been given. So as soon as they shout out given, you write it down. And that's what I did, and they did find that very helpful, because in that situation, no one thinks of doing it because they're too busy, getting the meds and doing the CPR and whatever. So they really do appreciate that, because in their head, they've got to then at the end try and figure it out what's happening. But in terms of coping, when I've seen it, yeah, if you need to talk about it, I did. I spoke about it to my mentor. They were all amazing. They were all like, are you okay? If you ever want to talk about it, please don't hesitate. And I did, because it is sad to see it, it's a little baby or a child, and it's awful. I mean, sometimes it's more the parents' reaction that gets you. All I'll say is try and hold in that emotion. If you feel you're going to cry, walk away, because the parents don't need to see that. Yeah, and talk to people. Obviously if you go home and talk to it, you can't give out patient details, names, whatever, but you can describe a situation. And that helps. Having someone that's not in your profession, it helps you see a different perspective on it, because all nurses just want people to get better and will do anything to get them back and blah, blah, blah. But, sometimes it's not for the best. There's a reason, and I think it does help talking to someone. So if you do feel really affected by it, talk. Obviously talk to the people who are there in that situation, because they might be able to shed a bit of light onto something. But, it doesn't happen that often, as often as you would think. And there's a lot more happy times in nursing. And, all you've got to do is treat that child with respect and know that you did what you could do. And, if you can walk away saying that, then you did a very good job. Especially the respect part, because, that's someone's child. You'd want to be treated with respect in that situation and with dignity. So, if you feel like you've done that, I felt like I'd done something good, treating that child with respect and dignity and everything they should deserve in that situation. I walked away and said, you know what? I did the last good thing for them, and, I helped the parents with it. So it is tough. It's still, I still do think about it, but you've got to move on, For every child that passes away, there's, hundreds that don't. So yeah, that's all I can say really. Let's see. I think that's it. Oh, here's another one. Do you think I'll be at a disadvantage for children's nursing if I don't have any recent work experience with children? No. If you're good with children, you're good with children. All I will say is, if you're not 100% sure about doing children's nursing, really think about it. It's a completely different side of nursing. You know, you've got to think of ways of making it easier for the child. You know, with adults, you know, you can just sit down, have a chat, talk about it on a, you know, equal level. But with children, you know, you've got children from birth up until the age of 16, 17, depends. So you've got to be able to talk to a 2-year-old and you've got to be able to talk to a 15-year-old. So that is one thing I would say. Make sure that it is for you. And, you know, obviously, you know, it comes with the training. People help you along the way. You don't have to be an expert at the beginning. You know, I definitely wouldn't have said I was an expert with children. I love children. That's why I did it. I have a true passion for working with children. I've always worked with children. Like I did loads of babysitting and stuff. But I wouldn't say it puts you at a disadvantage at all. You don't need experience with children to know that you're good with them and you'd be happy to talk to them and, you know, have a good time. As good a time as they can have on a ward, because it's not great for them, but you can make it that little bit better for them. So yeah, I'm done rambling on because I'm just chatting away. But yes, so if there's any more questions, please don't hesitate to send me a message, and if there's plenty, I'll do another video or I'll just answer you back. So I hope this was helpful and I will see you all soon. Bye.